On this week's episode, we're going to be talking about Achilles injuries and how to prevent them. This week we're going to be talking about Achilles injury and prevention with Dr. Mike. Achilles is located down by the ankle. That's pretty much all I know about it. So if we can kind of talk about where it's located and what it exactly does.
Yeah, so the Achilles tendon is just the continuation of the calf muscles. Calf muscles in the lower half of the leg basically allows us to jump, get up on our toes, ambulate, take steps, walk, and everything like that. And the tendon itself is just kind of the continuation, like I said, of that muscle as it goes and then wraps around the bottom side of the foot.
Okay. So like any tendon, it can get irritated, it can get injured.
Yes.
I guess if you were to incur an Achilles injury, what exactly would you feel? Would it be instant pain, or might happen later on, or?
So if it was like an acute Achilles rupture, you would know almost immediately. You're jumping, you're playing basketball, soccer, something like that. You go to push off, you go to jump, all of a sudden your leg is basically no longer functional. A lot of times what will happen too is the muscle will actually ball up a little bit on the backside of the calf. That's a pretty acute injury. That's something you go to the ER for. That's a surgical kind of thing. Simple Achilles tendonitis is probably not going to happen on a very acute basis. Usually it's kind of sore after a workout. You do your thing, go about it the next time you go, and you feel a little bit more so that time. That's more of a chronic kind of thing that comes on over time, gets a little bit worse as you're doing it, and typically you'll notice more of it when active. So when you're either going to jump, when you're going for a run, something that involves a lot of pushing off on the toes is where you'll start to feel that pinching, that pain in the backside of the leg.
Okay, so something that you should do instantly after injury, would icing help at all?
Yeah, ice would be a good idea, because same than anything else, we're talking about irritation, we're talking about inflammation. When that is the case, we're going to try to decrease that as quickly as humanly possible.
Okay, so decreasing inflammation, I think we're going to talk about the laser later on, after Rainey's Fitbit. That really helps with that.
Yep.
What other things can we do in the office to help with?
So a lot of it is going to be self-care stuff, instructions that we'll give. We'll talk about it in a bit here as well. Foam rolling, really good to keep the backside of the calves loosened up. Simple stretching of those muscles, kicking your foot up against the wall to stretch out the backside of the calf, doing like a downward dog kind of pose. Compression is really good too, so wearing either compression socks, using some type of like a voodoo wrap, something to get a lot of compression into the area, helps once again to flush out some inflammation and that swelling that may be present.
Okay, sure, thanks. All right, Rainey's Fitbit is up next.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about Achilles injuries. So I want to show you 3 different ways to strengthen your lower leg muscles to kind of help with that pain that you're having. This usually occurs mostly in runners, so if you're a runner, you're probably feeling this, especially if you run long distances. So your Achilles is actually located down here on the lower part of your leg, closer to your foot. So what that is a tendon that your calf muscle is called your gastrocnemius. Then there's a muscle underneath that called your soleus. It's where those 2 muscles meet together, form the tendon that goes down. So the first exercise that we're going to do is just like a calf raise. So the first way I'm going to show you to do it is standing on a step of some kind, and what you're going to do is you're going to raise all the way up onto your toes and then go all the way down. Just nice and slow, controlled movements like this. So this one, just doing it with your legs straight, is working that main calf muscle, your gastrocnemius. Then, once you've done those, you will bend your knees and go down and up. And this is going to work the soleus, which is the muscle underneath that one. So you want to make sure that you're doing both ways so you can strengthen both muscles like that. All right, and again, you might need to hold on to something. It's kind of hard to stand on the edge of the step and balance. All right, so then the next one, I'm going to take my shoe off for this one. This one we're working a little bit different muscle. This muscle is called the flexor digitorum longus, so it's like really long, complicated word, which means nothing to anyone really. But again, it's another muscle that's back here on the back of your leg, very helpful to keep it strong as well. So what you're gonna do is place your foot on a resistance band like this, and then you wanna pull on it so there's some resistance, kind of forcing your toes up. And what you're gonna do is push against it. So you're pushing your toes back down, and then allowing your toes to come back up and down, just like that. So again, just doing some reps on that side. And then the last one, for this one, you need a circular resistance band, kind of like this. Because what you're gonna do is you're gonna step on it with the one foot. You're gonna cross the other foot over your knee and pull the band up so that it's going over your foot, kind of like towards the middle of your foot. This one is working in a different muscle, again, another muscle that's in your lower leg called the tibialis posterior. So what you're gonna do is just kind of raise your upper portion of your foot upward, and then we'll relax it down, up, down. You're getting kind of like some rotation there like that. Again, slow and controlled movements. You don't need to do any of these quickly at all. Just nice and slow. So as you can tell, these are pretty like simple movements or simple exercises. All you need is just a couple of resistance bands. If you're a runner, I would suggest if running is hurting the Achilles, maybe try, biking or swimming or something to kind of take the pressure off of it for a while. Also, make sure that when you're doing these exercises that you're doing it on both sides. You don't want to really strengthen and work up that one that's hurting for the other one to start hurting. So make sure you're doing both so that you keep them nice and strong. All right, so that's been this week's Fitbit, and we'll see you next time.
We're back with Dr. Mike. We're going to talk about using a couple of tools to help people if they have pain, if they're feeling pain, but it's not severe pain just yet.
Yep. Yeah, so we're going to talk about just a couple of home care kind of things that you can do to help release tension that is going on within the Achilles tendon itself. And so the first one is going to be just using a simple foam roller. So we're just going to put it under her leg here, and we're going to be working just on this side over here. And so what she's going to do is just kind of roll her foot back and forth, rolling the calf back and forth on it. When she gets to a spot, if it feels a little kind of funky or kind of gnarly, have her just kind of stay in that spot and just point and flex your toe. Do that a couple of times. We can have her kind of roll her leg in this direction. Basically what we're trying to do is go from the back side of the heel where the tendon attaches, encompassing the entire calf muscle itself, because when the muscle is too tight, that's when we start getting all that pain and extra pressure coming in through the tendon itself. Another way that we're going to work with this is just going to be with a simple lacrosse ball. So basically same concept of what we were going to do before. Have her do a lot of the focus in the Achilles tendon itself, and she's just applying some downward pressure in that spot, really digging into that tendon. Same thing, when she gets a spot that feels kind of funky, have her point and flex her toe. With this one and with the foam roller, if you have somebody with you, you can actually have someone apply some downward pressure on top of it to increase the amount of pressure that we're getting into that injured tissue, that injured part of the muscle itself. Doing each of these for a couple minutes a piece is kind of the ideal.
Okay.
When it starts to get to where it's really painful or even more extra uncomfortable, it's a good time to stop, let it rest, let it relax for a little bit, and then you can start back up and do that again.
Okay, all right. And if I'm still feeling pain, continuing with that, or if it's getting to be pretty severe, what else do we have to do?
So another thing the one thing that we would do here in the office itself would be doing the laser. So using the laser itself, and so we would basically just take this, and this is getting in at the deep tissue level to really help to decrease inflammation and decrease the swelling. And so with this, we would start out and spend most of our time kind of focusing on the backside of the tendon itself, primarily at the insertion on the heel bone, but then also kind of encompassing the entire portion of the muscle, because as I said before, muscle gets overly tight, gets irritated, gets injured, that's when we're going to start getting all that pain in the Achilles tendon itself.
And how many treatments, I guess, depending, I guess it depends patient to patient.
Depends patient to patient. It's going to depend upon the chronicity of it, how long it's been going on for. So if you've had, say, Achilles tendonitis for 2 years from an old running injury, obviously that in that case is going to be a little bit longer versus somebody that injured it 2 days ago at the gym.
So this would help somebody that is dealing with an old injury too. It's
Oh,
not
absolutely.
just something that's super recent.
Absolutely, yeah. Chronic as well as acute. You know, typically most people don't let them go that long, but we do get a handful of people that have old sports injuries from way back when that eventually come in and say, hey, you know, just as kind of a side note, you know, not exactly what they come in for. Oh yeah, by the way, you know, I've got this, you know, this Achilles injury from back in high school or college or something like that, and then that's also something that we can address at that time.
And how long, or I guess, how long does each treatment last? Is it 5 minutes? Is it 30 minutes? Or
The treatment time itself in the
Yeah,
office,
yeah.
so typically between 5 and 10 minutes. It's
so
most,
super short.
yeah, pretty quick. Get you in, get you out, figure out what's going on with the laser itself. You know, less than 10 minutes for sure, especially for an area of that size. Less than 10 minutes for sure.
And I've had laser treatment before. It's not painful whatsoever.
Nope,
It's
not at all, yeah.
It's not hot. It actually feels kind of good.
Feels really good. Yeah,
Yeah.
absolutely.
All right, thanks, Dr. Mike. All right, guys, we're done for the week, so we will see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.